Sure, be happy to. And I might remind people that just so you get a flavor for the process itself, the governor's office starts talking to their directors of various agencies and responsibilities as early as November of the prior year, which they did. And so people begin to try to influence the process during that November, December, and January period. And as been the tradition for this governor, he's introduced his budget early in February. And in this year, we have a new chair to the House Finance Committee. And by tradition, the chair of the House Finance Committee is the sponsor of the bill. And the bill was assigned a number, House Bill 64. And in February and March, the administration, the governor's office, as well as his director of the Department of the Budget and some of the key other departments as well, begin doing presentations to the Finance Committee and talking about the various proposals that they've put forward. The budget itself is in excess of 3,000 pages, and so they subdivide it into a number of subcommittees, and the one that we follow the most is the Health and Human Services subcommittee of the Finance Committee, and those things begin to go on starting in mid-March, and there are hearings even today after the sub-bill, which came out on Tuesday of this week. The sub-bill was presented, and we're in the process of digging through all of those pages to find what we can about what changes were made, what things were deleted, and the next step will be that the full Finance Committee will be hearing testimony through today. They may make some additional changes early on Tuesday of next week, and they will either vote on Tuesday or Wednesday of next week on all of the sub-amendments and take the bill to the floor, where it must, unless they override their own rules, they must have it lay over one day before they conduct hearings. And so if we can go to the next, do I need to click it?
I got it.
Got it, thanks. Our policy objectives are clearly listed here. We believe that all Ohioans should have an opportunity to participate in the community, in the economy, obtain basics, and pursue a higher quality of life. It isn't just one segment of the population, but all. And that we feel very strongly about. We do place a very heavy emphasis on attempting to eliminate poverty and the effects of poverty. And I must say that there is a wide variety of opinions with respect to that whole issue of poverty, where some people believe that you can eliminate poverty in a 12-month period if you were just serious about it, and others who believe that that bringing people out of poverty is a complex issue and that it takes a number of years, and that is going to be one of the key ongoing debates in this round of budget discussions. We do believe very strongly that the work that people are required to do in order to gain assistance ought to be work that helps them lift out of poverty and not a situation where the only work they have available to them is in a job market where their work revenues are less than what they would be if they did not work. And it gets into some very complex kinds of issues, and that we spend a lot of time talking to people both individually, various participants in AOF put different perspectives on it, but we are in concert with our overall goal. And that's one of the things in that final point is dealing with an economy which has declining wages, and the median income has dropped 13% since 2003.
So what we're going to take you through next are some of the particular policy pieces that Advocates for Ohio's Future has been watching very closely in this budget. A lot of them have had some changes in the sub-bill, so we want to give you a quick update on these pieces and several that we've been following. And so we're going to start actually by looking at person-centered work programs, and I'm going to pass the conversation over to John Honick. John?
Thank you, Gail. As many of you recall, the initial budget proposal had language establishing a comprehensive case management program, and there was a lot of fanfare with this, and it really was sort of a centerpiece of the governor's strategy around helping people in poverty. So just to recall the basics of that, the program was to initially focus on youth between the ages of 16 to 24. It would have started in December 2015 and with that age group, and then it was to be expanded to all adults at or below 200% of the federal poverty level starting in state fiscal year 2017. It would have been funded with a mix of TANF and WIA funds, and each county was to designate a lead agency to carry out the program, which may have been a county JFS or a workforce investment board, or potentially some third party. Well, what happened with the substitute bill is that program basically was taken out. It was replaced with a clause stating that it is the General Assembly's intent to have any case management services regarding employment and training to be governed at the county level and provided through county departments of Job and Family Services and workforce development agencies. So it's replaced with a clause about intent. You should be aware that ODJFS continues to be committed to improving case management services, and they've actually hired additional staff to move forward administratively. It's possible that a revised version of the program will be reintroduced in separate legislation. Also, earlier this week, you should be aware that a working group of county JFS directors produced an important report about case management focused on the TANF-eligible population. And that report makes comprehensive recommendations about how to achieve person-centered case management, how to develop appropriate performance measures that recognize that coming out of poverty is a long-term process, and the importance of having a community conversation about poverty. So what's in the substitute bill now is some new language that revises the Healthier Buckeye Council program. Part of this program was already in law, and members have been appointed to the statewide Ohio Healthier Buckeye Council, which will make recommendations that administer the program. The new language requires each board of county commissioners to adopt a resolution establishing a local Healthier Buckeye Council by December 2015. The purpose of the council is to promote opportunities for individuals and families to achieve and maintain optimal health and to find ways to reduce reliance on public assistance. So the local councils will apply for grants from the state council, and these councilors are basically mixed public and private membership. And the key concepts in this proposal are this public-private partnership and really a focus on intensive long-term mentoring to identify mentors in the community, who can assist young people in particular. But a lot of the details have yet to be worked out. But this looks to be a serious proposal. There's an appropriation to go along with it. And it is something that AOF will try to get a seat at the table, and will continue to work with legislators. With that, I'll turn it back over to you.
A second area that we've been focusing on is programs that actually support Ohioans who are working but are still seeing, low incomes and below poverty level wages. So there are two initiatives that we've been working on in this budget. The first one is to increase eligibility for child care. We wanted to make child care available to a little bit wider range of people, up to incomes that are at 200% of the federal poverty level, and also make sure that once in the program, children could remain in child care for up to a year. We know that is really that a stable environment is really important in them having good success in learning and being ready for school, once they reach kindergarten age 5. We've also been looking at the Earned Income Tax Credit, or the EITC, which we know at the federal level is incredibly successful in helping to put money back into the pockets of working Americans. And so Ohio has an Earned Income Tax Credit, but it's not refundable, and that really limits the money that's available that reaches people. And so we've been working to make that refundable. What we've seen this past week is that we expect there to be an amendment introduced today, actually, to increase child care eligibility. We've worked with representatives to start to scale up eligibility, so it won't jump right to 200%, but what we're hoping for is to bump up eligibility over the next 2 years, working towards 200%. And we feel good about making progress on that front, helping people to access that program. And so the next steps for us are that we're going to watch for the child care amendment, and we have not seen movement in the House, in the representatives we've worked with, on adopting this proposal on the Earned Income Tax Credit. And so we'll continue in the Senate to look for opportunities for champions for that issue. Direct service workforce. Bill, I think this one's yours.
Sure thing. Whoops. I was just disconnected.
Oh, well, I hear you. Can you see me too?
I'm in good shape.
Okay.
The direct care workforce, we are pleased that we have made some progress. They have approved an increase in the House sub-amendment, a 6% increase, particularly for the developmental disabilities options, and there are some rate increases for that will be applied to the revenues that come for homemaker personal care, on-site on-call, and adult foster care. That amounts to $84 million over the 2-year biennium starting in January of 2016. And they also put in a 2% increase in the care providers appropriation, and we believe that that's going to be better if we were able to get a more significant increase. So we have a lot of work in this area in terms of working hard to get the care workers, the people who provide the direct service for those people who need Medicaid assistance, some better wages, because their wages, in many cases, people can qualify for food assistance, etc. So we are not there yet. We will keep you posted. We'll know more as we move on, and we're going to be pressing this issue hard in the Senate. We made some progress, but not nearly what we need to do. On the adult protective services level, we did get an increase in the budget of $3.2 million, and we are hearing today that another amendment will be put forward in the continued debate before the bill leaves the House and goes to the Senate, and that amendment would increase that $3.2 million up to $10 million, and that was the same amount of money that was put into the midterm budget that was adopted last year. There are a couple things that we have to watch for because we still have a rather interesting provision that is contained when it comes to adult protective services, and that is that the obligation on the part of the state to assist people who have problems in this area is only there for service and assisting if revenue is available. I personally find that very interesting that we, for instance, do not have language in any budgets in the state or local area that if your house catches on fire, that the fire department can say, well, no, we don't have the budget, so we can't come and fight the fire. But when it comes to people who need protection in an amazingly increasing number of people dealing with fraud and abuse, physical, both emotional, physical, and financial, we have a provision that says, well, if we haven't put enough money, people will just have to go on with their lives without us providing any assistance. So I think we have to really struggle with that one as well. Food assistance. I think you probably have seen newspaper article after newspaper article which talks about the issue of the need for food assistance. It's higher than it's been for a very, very long period of time. We are pleased that the state put in another $2.75 million for food assistance, but according to all of the information available and all of the data that shows how much is likely to be needed, it is in a need for another $2.75 million per year, up to $5.5 million. So we're halfway there. We have another house to go. We're going to be dealing with it over in the Senate, and I think it'll be most important that we are able to work to get additional money for the basic part of life, that being with food. So Gail, with that, I'll turn it to you.
So we partner with one of our coalition members, Ohio, and they really are the experts on looking at housing in the Ohio Housing Trust Fund. And so we have been following their leadership in this issue. And their goals in this budget really have been to maintain funding for the Ohio Housing Trust Fund that supports building projects and housing for low-income people across the state. So what we've seen this week in the sub-bill is that the funding for the Ohio Housing Trust Fund has been maintained, which we're really happy about. That was a hard-won line item and really important to maintaining housing and opportunities for housing in Ohio. So the next steps for us are to thank the House members for continuing to support this, and we'll monitor it in the Senate to ensure that we address any concerns that come up in that chamber. Medicaid, this one's for you, John.
Okay, thanks. So, as usual, Medicaid is an area where there's a lot of action in the budget. It's at this point the largest state program when you include the federal share, and this time around has proved to be no exception. So one of the issues that AOF has been following has been with regard to certain optional coverage groups, and you see them listed there: pregnant women, coverage for individuals who have breast and cervical cancer, and the family planning group. So just to refresh your memories about current laws, so these are groups that are optional. They're not required by federal law, and they have categorical eligibility up to 200% of the federal poverty level. And so the executive budget had proposed to eliminate Medicaid coverage for these individuals whose income exceeded 138% of the federal poverty level. So if you're above the level for the Medicaid extension or Group 8, you would be excluded. And the theory here was that these groups could use the health insurance marketplace exchange. And basically the House has decided to accept the proposal. So as it stands now, House Bill 64 would remove the coverage for these three groups, and creating potentially harmful gaps in coverage if individuals cannot access the marketplace in a timely fashion. And just to explain one of these situations in greater detail, as you have likely heard, pregnancy alone does not trigger a special enrollment period on the health insurance marketplace. So if an uninsured woman becomes pregnant outside of the regular enrollment period, she has no way to access insurance. And AOF feels that comprehensive, timely prenatal care is vital for the health of the mother and the baby. It's a key factor in healthy birth outcomes, which can contribute to lowering the infant mortality rate. So this is an extremely important issue, and we continue to support the restoration of eligibility to 200% of the federal poverty level for these three groups, both for their own health and for the goal of reducing infant mortality. And as you likely may have heard, that the budget has some major changes with regard to putting in place a health savings account, and the state would have to apply for a waiver to make these changes. But it's an issue we're concerned about and we're watching very closely. So if you recall, the administration's original budget proposal contained a proposal for premiums that affected part of the Medicaid extension population, also known as Group 8. The changes were not actually part of the budget language, but were part of a budget policy package that was presented by the Office of Health Transformation. So in the original proposal, people in the Medicaid extension population with incomes over 100% of the federal poverty level were asked to pay monthly premiums for coverage. The average premium would have been about $20, and this would have affected about 100,000 people, and that would have required a waiver from CMS. Some of the details were unclear, including exactly how the premiums would be collected, whether the premiums would have to be repaid to the federal government, and whether there are provisions for exempting recipients because of hardship. So that proposal is now is apparently off the table, and the House has replaced it with a much broader structure that would affect about 2.2 million people, both in the covered families and children part of the program and in the extension or Group 8 part of the program. This would include 1.2 million children, including kids who are on the CHIP parts of the program. So the House version has a premium as well that would be equal to 2% of family income for recipients at all income levels, with a minimum monthly contribution of $1. Other organizations can pay part of the premium on the individual's behalf, but not all of it. If an individual fails to pay the premium for 60 days, they fall behind, they would be locked out of the program for 12 months. Premiums would be deposited into an HSA or health savings account type of structure, which would also receive a contribution of Medicaid dollars. Individuals would have an annual expense limit of $300,000 and a lifetime limit of $1 million. If they exceed those limits, they would be placed in a catastrophic care program, but the bill contains no details of what this program would look like. The program is extremely complex and requires detailed tracking of both the Medicaid contributions to the account and the non-Medicaid contributions. And I'm not going to go into all the details because very clearly this is a work in progress. The plan appears to be based somewhat on a waiver that was approved for Indiana, but it goes much, much farther, and it really will test the boundaries of what CMS may approve. So we at AOF are committed to participating in discussions about the HSA and making sure that Medicaid recipients have as clear a path as possible to maintaining their benefits. We're still trying to understand all the implications of this proposal, and we will keep you informed as the plan changes. So with that, I'll turn it back over to you, Gail.
Thank you.
On the mental and behavioral health issue, we are somewhat more comfortable in that the budget language was removed and remains the current language, but there is a intent on the part of legislators to see if there's a way in which to move the individuals needing mental and behavioral health assistance into managed care. You may recall that we finally implemented managed care for those individuals in long-term care in need of, who are dually eligible for Medicare and Medicaid. And we've completed the first year of that process, and there are still areas and issues in that arena. And the message that we were attempting to get, and I think that we have been positive in getting it, is we need to be careful, and we need not to move so quickly just to get it accomplished, but we need to make certain that people are comfortable, that people know what they're receiving and how to go about it, and have an opportunity to have more interaction face-to-face than we had as we dealt with the dual eligible program. So there's reason for optimism in this arena. We're not there yet. We know that the work will continue over in the Senate to make certain that, and our focus is going to make certain and advocate to make certain that there is a clear process put in place and a clear timeline for the transition to managed care. Gail?
All right, this is the last area that we've been following especially closely in this budget, and that is child welfare. Our goals for this budget, and we really follow the lead of our partners, PCSAO, or the Public Children's Services Association of Ohio. And the goals really in this budget were to increase funding to meet the growing need. The child welfare system in Ohio has seen an increase in cases related to the opiate epidemic in Ohio and related to several other factors. And so they've been looking at the care in each county and the large differences in care for each county, depending on whether there's a county levy in place and what other funds are available at the local level. And so the goals in this budget have been to increase funding from the state to meet that growing need and to help make sure that there's equal care and opportunity for children regardless of the county they live in Ohio. Unfortunately, we're not seeing changes in proposed funding for the child welfare system. There just has not been a foothold so far in the House. And so we're going to continue to follow this and to continue support requests for additional services to protect children in all counties. And we know that these conversations will continue in the Senate. And so we'll keep you updated as there are new developments in the child welfare arena. What I want to talk to you about now, so you can see that we're really following a wide range of issues. Some of them have had some great successes in the budget so far and have found champions in the House, and we've been able to work with legislators and the administration on that. And there are others where we continue to look for improvements or there are changes, things that we're concerned about. And so we're asking for your help today to help us advocate for the proposals that we think will most benefit the lives of families, children, and communities in Ohio. And here's what we're doing. Today we are testifying in front of the House Finance Committee, and we are responding, as you've heard today, to some of the proposals that have been made. And so here's what you can do to help us. We'd like to ask you to make 2 calls to Finance Committee members today, and we've set up the system so that you can identify either your representative, if they happen to be on the Finance Committee. Not all representatives are on it, but there are 32 members on there, so there's a good chance that there's a reasonable chance that your representative is there. And we'd like you to ask them, to let them know that you're a supporter of Advocates for Ohio's Future, and ask them to please review and support the recommendations that our coalition is putting forward. So we've provided them with materials and some information similar to what you've heard today, and we're asking you to help us get the word out that we want them to look at those proposals closely and consider what policies will be best for Ohioans moving forward.